Greetings, Dr. Bakman here. Dr. Raleigh and I just wanted to give you a few updates, what's new here in 2018. We wanted to address some of the new changes to our billing. First of all, you may have got a cleanup statement from 2017. If you get it and the amount doesn't seem right or it seems inaccurate, please let us know before it. We always tell our patients that we'd love to go over their bill with them. So just give the office a call and they'll direct you to the billing department and we can address your statement for you. As far as the new billing for 2018, we have contracted with a group that has an expertise in billing functional medicine in the PPO insurance world. There's a couple of things we want you to know. First of all, we're contracted in network with most of the PPOs, including Medicare. So we have to abide by our contractual agreements with them. Number one, we have to bill everything that we do in the office. Billing is no longer just about billing a fee to get paid. It's about communication. Communicating to them about everything we're doing in the office as far as every Band-Aid, every needle, everything we do. The second thing to understand about it is that there's really two sides to the billing statement for the insurance company. There's the allowable column, and these are the contracted things that they will pay, and then there's the non-allowable things. So you'll have this big bill go out. By the way, they set the prices for each of the codes that we bill. We don't set that. But you'll have this bill go out, and then they'll send you an explanation of benefits at your home. It'll have the total amount billed, and they'll have the allowable amount of what you'll have to pay off of, and then it'll have the non-allowable, which you do not pay on. So I'll give you an example. Let's say that we bill out $1,000, and 500 of that is non-allowable. So the other 500 is allowable. And let's say that you've already met your deductible, and let's say you have a 20% co-insurance. You would be liable for 20% of the 500, which would be $100. There's also a term called out-of-pocket maximum for the year, and all it really means is you've spent so much money that at that point you don't have to pay anything more. The insurance company will pick up all of it. So what does this really mean to you? So let's say that you come in at the beginning of the year and your deductible has not been met. Okay? As we do our billing, you may go through your deductible and your co-insurances pretty quickly. So you may get a bill from us on a statement for that full amount. No need to worry. If you're worried about having to make that payment all at one time, we have contracted with a healthcare credit company called Care Credit, and you can make a selection. You can choose 12 months and you can pay on that interest-free. Okay? We do pay a small percentage on the back end so that you can have that ability. Okay? So it's pretty simple. We're just following the rules by which they set for what we bill, what we get paid for, and we try to just make it simple for you on that. If you have any questions or if anything doesn't seem right, please contact us and we'd be happy to review it with you. Now, one last thing, laboratories. The national labs, like LabCorp or Quest, they're in network. So that will fall into the same category as the billing that we do in the office. Some of the other labs are not in network or they're out of network, like Genova Diagnostics. We do one test with them called the NutraVal. It's going to bill to the insurance company at about $2,800. But since Genova doesn't have a contract with the insurance company, they have a list of the different PPO insurance and what they call an easy pay portion that you'll be liable for. So they basically cap off your exposure. So let's say you pay $159, $160. That's all you pay, irregardless of how much money that they get paid for by the insurance company. So here's what you got to remember though, is as that bill goes to the insurance company, you'll get the explanation of benefits to your house. You'll see that they may have billed out $2,800 and they did not pay for any of it, and they may put that whole $2,800 in the patient portion. You don't owe that. There's no contracts here, so you'll owe the $160. I know that this stuff can be confusing, and we really want to make all of this make more sense. So if there's any questions, just let us know. We'd be happy to talk to you or sit down with you and explain it more in details. Then again, we just want to thank you for trusting us with taking care of your health, and we'll see you in the office.